Hello, how are you? I know some parents panic so much when they have realized that they have given birth to children with special needs. But I want to tell you today that you should not panic. So today we are going to talk about how to handle children that have deafness or hearing impairment. If you are a parent and you've given birth to a child with hearing impairment, how best should you cater for this child? Number one, you should not panic. So make sure that you take good care of this child, and as early as possible this child is taken to hospital, and if possible is assessed by the doctor so that the level of hearing impairment or deafness can be evaluated. There is some that can be corrected either through medication or medically, but there is those that we find that now alternative methods of communication through early intervention can be implemented so that this child can be assisted to start communicating as early as possible. And being that I've been in the field of special needs education and I've been teaching students with hearing impairment for quite a number of years, I am experienced now to talk about this area, and it is one of the trickiest or tricky area of special needs that you find that some parents do wonder how best will they handle their children, especially those that now have hearing impairment. So you need to take your child to the hospital, and the doctor will determine, there is those hearing impairment that come as a result of maybe ear infection and or ear diseases. So when it is due to that, the child might be assisted while still young. But there is those that you find that it is a permanent condition to the child. So in those scenarios, you find that now how the best way possible through which this child can be assisted. If maybe it is just a partial hearing loss, then you will be advised that this child should be fitted with a hearing aid that can assist this child to listen to information or just to hear, so that the child can start to practice speech as early as possible when they are fitted with a hearing aid. But there is those that you may find that their parents now, the child is totally deaf and can't hear, and maybe the parent feel that they want their children to be assisted to speak. So those children, an operation might be done, and the children are likely to be fitted these children are likely to be fitted now they are likely to be fitted now with a system that can enable them to hear once they are operated, so that they can hear. And then there is those parents that they can't manage the cost of operation. So those parents now can strive for to learn Kenya Sign Language as early as possible, so that this child can start to build a language that they can use to communicate. So the parents should strive to start learning sign language and also teach their children sign language, so that by the time this child gets into the milestone where we find that regular children, typical children, always start to speak. So also this child with hearing impairment at that age will also be at a position to do what? To communicate. Now, not verbally, but through the use of sign language. Why am I insisting on this? You will find that if these interventions are done appropriately at an early age, you will find that when this child joins school, already the child has a native language, which is Kenya Sign Language, or is fitted with the hearing aid, or operation has been done, and some of the hearing is corrected. So through that, now when the child joins school at an early age, the child is not starting from zero. So at least the child has a language and can learn and will catch up like the rest of the children. So this message is very important for parents that have children with hearing impairment, or parents that have children who are deaf, or generally to the public, or people that feel that they want to learn more in the area of hearing impairment and how best they can help those children